Hi, this is Dr. Mike Chupp, and you are listening to CMDA Matters, the weekly podcast of the Christian Medical and Dental Associations. Well, last week, we brought you a special edition of our weekly program with two physician ministry leaders, Dr. Peter Saunders and Dr. Jim Pepon. They've been intensely involved in bringing medical aid to the people of Ukraine in the midst of a Russian invasion. We made a special appeal to you, our listeners, as well as the rest of our CMDA family, to give help to Christian healthcare professionals serving in Ukraine with much needed medical supplies in this crisis. I'm thrilled to report that over $140,000 has come in as a result of your generous giving to this cause. When I let Dr. Saunders know, he was overwhelmed with gratitude by the generosity displayed by CMDA USA members and champions. He wanted me to extend to you his heartfelt thanks for this rapid, generous response. You know, there's still time to give in this effort to serve our Christian brothers and sisters in healthcare who have remained in Ukraine, as well as in bordering countries like Poland, where there are national partners with the International CMDA. You can just go to cmda.org/Ukraine and you can give your gift today. I want to guarantee you that all of these funds will be shared with the ICMDA Ukraine relief efforts. Well, on our episode today, I am joined by Pastor Bert Jones, who is the director of our leadership and church relations efforts. And we interviewed Dr. Andy White, who recently released a book entitled Mending a Broken Mind. I asked him to take a few minutes and to share with us about his personal journey through clinical depression. As a Christian family physician and educator of more than 40 years, who added seminary training along the way, Dr. White has found that treating the whole person who has clinical depression is the most effective way to be healed from this dreadful mental illness. We know countless numbers of people experience depression on a daily basis, and that number has only increased over the last 2 years as a result of the COVID pandemic. Our discussion today is going to be useful for healthcare professionals, as well as counselors, pastors, and others. So keep listening as Dr. Andy White, together with Pastor Bert Jones and I, discuss Mending a Broken Mind. Well, today on CMDA Matters, it's a great privilege to welcome, to join me as co-host, Pastor Bert Jones, who's our Director of Leadership and Church Relations. Good day, Bert.
Hello, Mike. How are you?
I'm doing well. Well, today we have Dr. Andrew. Well, I've known him as Andy for many years. Dr. Andy White, who also has a master's in theological studies. He's a Christian family physician and educator who's had seminary training. He practices family medicine with a special emphasis on mental health in Winchester, Virginia. He's founding director of Shenandoah Valley Family Medicine Residency in Winchester, as well as in Front Royal, Virginia. He is an associate clinical professor of family medicine at Virginia Commonwealth University School of Medicine in Richmond, Virginia. And I alluded to it earlier that I've known Andy for many years because I was partner with his younger brother, Russ White, in Kenya for a number of years at Timok Hospital. Russ is a thoracic surgeon, and we worked day in and day out, week in and week out. And I heard lots of tales of his older brother, Dr. Andy White, family physician. So, Dr. White, welcome to CMDA Matters today.
Thank you. I'm happy to be with you.
Well, we've invited Dr. White because for a number of years, he, I believe, has been thinking about writing a book that would capture what he has faced in his life, which I believe is 7 different episodes of clinical depression himself, and therefore a keen interest in the management of clinical depression. And then it was in 2013, I was in a worship service in Kenya at Timok Hospital when Russ shared with us a prayer request. Please pray urgently for my brother Andy. He's been diagnosed with advanced kidney cancer, and he's still struggling with depression. And we prayed, and I'm sure others prayed, Andy, and God did some pretty incredible things. Would you tell our listeners just a little bit about your story?
Yes. So you're correct. I've had 7 depressions. 2 have been disabling. I want to spend time on the last one, which started in 2004, and it lasted for 10 years. The last 2 years of that depression, I was totally disabled. And that, near the end of that 10 years, I was diagnosed with metastatic kidney cancer to the lymph nodes in the abdomen and the chest. Well, I actually was thankful that God was going to take me home. I was so sure that I would be dying that I actually got my tombstone. And on it, I wrote the words that Job once said, who himself had struggled with depression: though he slay me, yet will I trust him.
Hmm.
But God had a different plan. I actually did not want to live, but who Russ and my brother Joel said, well, let's pray that God heals you from both the metastatic cancer and the depression. But if he doesn't heal you from the depression, we're okay with God taking me home. Well, miraculously, the day before surgery, they did an MRI. None of the lymph nodes were positive on that MRI, although they'd been previously present.
Wow.
The kidney cancer itself was 4.5 pounds. And and then when they did the surgery, they removed the cancer and it was contained in the kidney. Indeed, the lymph nodes were negative. Well, another remarkable thing about this is that I had been on many medicines for this last depression and had had 2 courses of electroconvulsive therapy without really any significant improvement. But the night before my surgery, the resident at NIH gave me a small dose of a medicine that I'd never had before to help me sleep. But what I noticed in the morning of surgery, is that I actually felt a little better in terms of depression. And with escalating doses of that medicine, I was completely healed from my depression as well. So that on the very day that I had curative surgery, I also started to recover from that depression. So I like to think of it as a miracle 3/4, 1 3/4 miracle, because certainly the cancer remission was miraculous since there had been no chemotherapy or anything like that. But I also think it's more than a coincidence that the very day of that surgery, I started to improve with the depression. And as you've said, people around the world were praying for me. I know Mike was praying for me, but when I went to Tenwick after that, I met all sorts of people who had been praying for me there, and I heard from people all over the world. So I definitely believe in the power of prayer.
Well, we all do, Dr. White. And you mentioned that God had a different plan for your life. And I believe that part of that was you writing this book, Mending a Broken Mind. When you sent it to me, I couldn't put it down. I was intrigued and appreciated your transparency. You talk a lot in the book about clinical depression, but don't really go into a lot on discouragement or just the depression, basic depression. Is there a reason why you focused on the clinical aspect?
Yeah, there is a reason why. I actually think clinical depression is a different disease than discouragement or mild depression. And I think that many of the things that are helpful in books and other avenues of information, that many of these books that deal with discouragement and mild depression, many of the things that are recommended actually might be hurtful for people who have a clinical depression. They're not able to meet the challenges that people with discouragement and mild depression have. So I wanted a book that was specifically for people who had moderate to severe depression.
Dr. White, the magnitude of depression, I think it is skyrocketing these days. In the timeliness of this interview, I get the Washington Post and an article that came out yesterday written by Lenny Bernstein entitled, "This is Why It's So Hard to Find Mental Health Counseling Right Now." And in this article, Andy, the statistics are just staggering. The number of help calls that are going into a national hotline for mental health and addiction problems, the numbers are skyrocketing. The number of children that are seeking help from professionals, child psychiatrists, well over 1 million now, the article estimates, and there's only a little over 8,000 child psychiatrists. So clearly the magnitude with the COVID pandemic has exploded over an already elevated baseline. Can you talk to us what your perception of the magnitude of the problem in the U.S. and abroad?
Yeah, even before COVID, we know that 8% of people at the same time are experiencing clinical depression. That's 8% prevalence rate. We know that it's twice that among adolescents and young adults, and that was before COVID. We know from the World Health Organization that before COVID, 20% of the world population has a mental illness. They subsequently have done a follow-up study, and it's doubled since COVID. So it is an epidemic, not only in the United States, but worldwide. And one of the saddest things that we're seeing is the second most common cause of death in adolescence is suicide, and that number is going up rapidly. And you're absolutely right. You know, I do some counseling in my work, but I also manage medication. When I have someone who has some more complicated problems like post-traumatic stress disorder causing their depression, I like for them to see a clinical psychologist. But it'll take me 6 months to get them in. And these people don't have time to wait for 6 months. So I end up doing the counseling myself, even though I'd rather, I can't spend as much time, but somebody's got to do it.
While those numbers are going up and up, staggering numbers, it seems like one of the lies that the enemy has is a strangling stigma that a lot of people carry right now that I'm the only one struggling with this. And I thought it was incredible, the historical aspect that you gave examples of historical figures that we all look up to who struggled with deep depression, clinical depression. But the biblical examples were fantastic. Give us a little picture into some of the biblical examples that you talk about in the book.
Yeah, I'd like to do that. I'd like to talk about Job first. You remember what he said is on my tombstone. Job, we're told, was a blameless man. Now, that didn't mean, that's what God said of him. That didn't mean he was perfect. It just meant he was a lot better than everybody else. But Job, as you know, suffered severely when his children were killed, then subsequently developed a really bad skin problem. And here is what Job says is he describes his depression kind of using the image of his birth date. And here's what he said. We didn't have psychiatrists back then, but this sure sounds like depression to me. Quote, "Let the day perish on which I was born, and the night that said a man is conceived. Let that day be darkness. May God above not seek it, nor light shine upon it. Let gloom and deep darkness claim it. Let clouds dwell upon it. Let the blackness of the day terrify it. That night, let thick darkness seize it. Let it not rejoice among the days of the year. Let it not come into the number of the months. Behold, let that night be barren. Let no joyful cry enter it." So that's Job. And to me, that sounds like clinical depression.
Sure does.
So, Andy, you imply in your book that it's relatively easy to screen for and diagnose depression. Talk to us about screening.
What I really like is there's 2 screening forms that have been validated in many clinical studies. The first is called the PHQ-2. It's 2 simple questions that you can read in my book and memorize easily. The first question is, over the last 2 weeks, have you noticed less interest or pleasure in doing things? And then the second question is, over the last 2 weeks, have you felt depressed, down, or hopeless? And those two simple questions are really easy to memorize, and you can find them again in my book. But then the follow-up to that is something called the PHQ-9 that, while it's used for screening, it's almost diagnostic for depression too. You definitely need a psychiatric consult, or, a consult with most primary care providers, including nurse practitioners and PA. But that PHQ-9, you can take that in 3 or 4 minutes, and there's a scoring legend that can help you get a handle on how severe your depression is. So, yeah, I think there's never been a day when there has been so much that we can do with simple screening tools.
Well, Andy, you're a clear believer that it's not just medications alone that give the best results. And can you just talk a little bit about that, unpack that from what you share with us in the book?
Yeah. So I'd like to tell you that we now know for sure that antidepressants and or counseling, both even better, but antidepressants and or counseling do the following. They shorten the current depressive episode, they decrease psychosocial impairment, decrease risk of suicide, increase quality of life, and decrease relapse rate. And what I would say is that in clinical depression with moderate depression, it's pretty much okay to try either counseling or antidepressants. I do believe if it becomes more severe, that both should be a part of the treatment. And again, like I said, there's numerous research studies to show that this works. And what's wonderful about the antidepressants today is they are very safe. And even when there are side effects, they can be easily reversed. And if you can't tolerate one medicine, there are many others. And in terms of the counseling, we now just have wonderful evidence about the value of cognitive behavioral therapy and interpersonal therapy. And these two types of counseling techniques are completely compatible with the Christian faith. So for people that are struggling with moderate to severe depression, please get help.
Dr. White, I've always believed that if you could have a takeaway from a book, it was worth the cost of the book. And there's so much good in this book, and I highly recommend it to our listeners today, Mending a Broken Mind. But I thought the thing, you talk about spiritual myths and 8 spiritual helps, and I thought that was so good. Can you talk to us a little bit about that concept?
Yeah, I believe there are 4 spiritual myths about depression. The first myth, depression is usually the result of a specific sin or sinful lifestyle. Number 2, depression is due to a lack of faith. Number 3, happiness is a choice. And number 4, suffering always comes directly from Satan. Now, I don't want to go in detail with the first 2, but of course, the example of Job and also Jeremiah, it's clearly was not sin that led to their depressions, and nor was it a lack of faith. These are heroes of the biblical faith.
Right.
So if you have depression, you're in good company. But I do want to talk about the happiness as a choice one, because I think it's a particularly hurtful thing that can be said. I've had people tell me when I was depressed to rejoice in the Lord always. And I say again, rejoice. And the implication is that I'm not trying to.
Right.
When I'm severely depressed, I can't rejoice. Now, sometimes I'll get a little bit of relief when I go to church and hear the songs and take communion. But even if I get improvement, it's only a little, and the depression comes right back. So, rejoice in the Lord always. Again, I say rejoice. It is not a command like some preachers have said. It is a word of encouragement. Yes, you should try to rejoice in the Lord. But if you can't, you've tried, don't take on inappropriate guilt.
Well, what words, Andy, would you have for fellow primary care physicians, whether family medicine, internal medicine, med peds, OB, so forth? Because of this deficit that we've talked about, that I think we all recognize, we just don't have enough mental health professionals out there. It seems like a golden opportunity for Christians who have established practices or those who are even getting started in practice. Maybe some would not see mental health as a priority. What would you say to admonish our members who are listening?
This is, again, with the screening tools we have, with the ability that we have to manage depression with antidepressants, with the brief counseling that we can do, just 2 or 3 minutes in the office can often help a patient, and then to recommend counseling. A lot of people with depression, need permission to get counseling. So, yeah, and I would say that I think just like heart failure and COPD and diabetes, which are common illnesses, are a part of primary care practice, I think depression treatment should be as well, along with anxiety treatment and others. We have everything necessary to diagnose it and to successfully treat it along with counseling.
Dr. White, I've often heard it takes a village to raise a child, but I think it also applies to this subject matter here as well, because it's one thing to speak to someone who's struggling with clinical depression, but there's family members involved in that, spouses, parents, kids. What would you say to some family members who maybe they're not struggling with clinical depression, but they're related to someone, love someone, care about someone who is? What kind of encouragement would you give them?
First of all, I think one of the most important things is just to come alongside of someone with depression. Listen to their story, really compassionately listen to that story and affirm them in their story and affirm their feelings. People with depression don't want to feel sad all the time, but they do. And just knowing that a family member understands them. Now, I say that, but if you've never had a depression, you shouldn't come across as knowing how they feel, because if you've never had a depression, you do not know how they feel. But here are some of the things that in my book that I tell people right off the bat when you start talking to a friend or family member. Just these 6 things. You are not alone. I intend to be there no matter what. 2, I may not be able to fully understand how you feel, but I want to try to understand. 3, I love you and care about you and want to help in any way I can. 4, please tell me what I can do to help. Would going to a movie help? Would praying with you help? Would you just like me to hang out with you? Or do you need some time to be alone now? Number 5, you are important to me. I can't imagine life without you. 6, try to hold on one more day. If not one more day, one more hour. If not one more hour, one more minute. If you can't hold on anymore, we need to get help right away. So these are only a few of the things that I mentioned in the book, but there is so much that we can do. And the church too can be helpful. I think of healing prayer. In our service, we always have healing prayer at the end of the service. And the people in our church, because of my ministry there, are very willing to come and ask for prayer for depression, anxiety, addictions. We can sponsor depression support groups. It's easy to run a support group. People are just sharing their stories. The only 2 things you need to always have in a support group is, number 1, everything is confidential. And number 2, what works for someone else might not necessarily work for you. And then there are people in our church, I and along with them, that sponsor special healing conferences where we address depression. Our church actually supports me in my mission overseas in Africa. Financially, they help. And my mission in Africa is the same as it is in America, and that is to help bring relief to those suffering from depression. So There's a lot we can do individually, a lot corporately. I would encourage you, if you do come alongside of someone, to set some boundaries. Depressed people can be really demanding. You may hear the same thing over and over again. And if you just are too exhausted, just say, let's talk about it again later this week. And if you yourself start feeling depressed and anxious because of that relationship, you might want to get some counseling yourself. Nothing wrong with that.
Well, Dr. Andrew White, congratulations on completing this magnum opus of your life, for having struggled through decades of depression and then having God heal you and have the fortitude, the time, and the desire to write such a book for not just for the healthcare profession, but frankly for patients and their families who are struggling with depression these days.
Thank you so much.
I hope that you were encouraged today by Andy's transparency about his own journey through clinical depression. His book, Mending a Broken Mind, is a powerful personal testimony and treatise on the power of prayer, as well as counseling and medical therapy for depression. Andy's personal lifetime experience with depression makes this book a tremendous labor of love and a must-read for healthcare professionals, as well as our patients and their families, pastors, and others engaged in mental health care inside as well as outside of our churches. I encourage you to order your copy today, especially if you yourself or someone close to you is suffering from depression. To purchase your copy, you can visit our CMDA bookstore by going to cmda.org/bookstore. You may have heard Pastor Bert Jones admit during our discussion that he was so captivated by Andy's book that he couldn't put it down. He had to keep reading. From a pastoral perspective, Dr. White's practical helps from this book will prove incredibly useful, I believe. Bert is the director of CMDA's Leadership and Church Relations Ministry, and he's focused on helping make connections with church leaders to share some of the great resources available through CMDA. He's also director of CMDA's Center for Well-Being, which helps Christian healthcare professionals align with God, optimize our well-being, and maximize our influence. If you happen to find yourself feeling some of the symptoms of depression, or if you're feeling burned out and overwhelmed by your daily demands, please reach out to Pastor Bert and CMDA's Center for Well-Being. You pour yourself out for others every single day, and this is the place to be refilled. Our coaches at the Center for Wellbeing want to help you find the sweet spot of life again, to help you find or regain what the Bible calls shalom. For more information, just visit cmda.org/wellbeing. Pastor Jones recently authored an article in our spring edition of CMDA Today, which is our quarterly magazine. His article is entitled, How to De-Stress in Your Distress. One of the consequences of the pandemic has been the increase of stress and the decrease of well-being among healthcare professionals. It's the rise of frustration and the fall of fulfillment in serving. Under pressure to perform long hours, few have forced themselves to address the personal stress that they face as a result of this ongoing crisis. Failure to address the stress in one's life will often progress into a state of deep distress. If you're feeling that distress, I encourage you to read Bert's article. You can find it and other articles from our magazine at cmda.org/CMDA Today. Well, from time to time, you've heard me talk about on the program several of our specialty sections. The CMDA's psychiatry section is an essential piece of today's discussion on depression. The psych section strives to promote fellowship and provide community to support as well as encourage Christian physicians in the practice of psychiatry as they're exploring the relationship between their faith and their professional practice. They also promote within the church the knowledge and understanding of valid psychiatric approaches to mental health and healing, those that are consistent with Christ's redemptive love. If you'd like more information and to get involved, just visit cmda.org/psychiatry. If you haven't been to our Learning Center recently, now is the perfect time to do so because we just added a couple of new episodes to Faith Prescriptions. This on-demand video study is free for our CMDA members, and it's specifically designed to help you live out and share your faith in your practice. It provides training on everything from LGBTQ issues in the healthcare arena to praying with your patients and sharing your faith in ethical and appropriate ways with your colleagues as well as your patients. You can get started now. Just visit cmda.org/learning. Well, one piece of advice that I would personally give to anyone suffering from depression is how important it is to spend time in fellowship with other believers. And I got a wonderful opportunity for you to do just that next month at the 2022 CMDA National Convention on April 21st through the 24th in Indianapolis, Indiana. It's been more than 2 years that we've gone without getting together, and instead we've connected virtually. This is going to be an opportunity for us to be together again, and we hope to find renewal, refreshment, as well as revival. You know, space is filling up fast. In fact, I believe that we have less than 50 spaces available at the Marriott East in Indianapolis. So just get cracking and register by going to natcon.cmda.org today. Well, speaking of the National Convention, I think you'll want to join us next week for a special interview with Pastor Dennis Rouse, who will be our Bible teacher at the convention this year. He will be joining us next week to tell us how God enabled him, as well as his wife Colleen, to grow one of the most multinational congregations in America today. His churches are in Atlanta with members from 140 nations. And he'll give us a glimpse into what he'll be sharing with us in April, so you don't want to miss it. As I close today, I'd like to remind you of the verse from Job that Andy mentioned just a few minutes ago in our conversation. He told us that in Job chapter 13, verse 15, Job tells us, "Though he slay me, yet will I trust him." If you're experiencing deep discouragement, depression, or distress in your life right now, I'm praying specifically for you. And I'm praying that you will trust in our Savior no matter what circumstances you may be facing. And as you trust Him, our Lord Jesus will use you to bring the hope and healing of Christ to a world, your world, in crisis. That's what matters to CMDA, and CMDA matters. We'll see you next week if Jehovah Rapha, the healer of our minds, wills it.
This podcast has been a production of the Christian Medical and Dental Associations. The opinions expressed by guests on this podcast are not necessarily endorsed by the Christian Medical and Dental Associations. CMDA is a nonpartisan organization that does not endorse political parties or candidates for public office. The views expressed on this podcast reflect judgments regarding principles and values held by CMDA and its members and are not intended to imply endorsement of any political party or candidate.